at one of the busiest markets in Lagos, a place where, of course, people are buying and selling, so there's a lot of money exchange and physical contact. Nothing seems to have changed in spite of the 2 confirmed cases of coronavirus, and many people here tell me that they are not worried at all. Have you heard about coronavirus?
Yes, I have.
And are you worried that it's going to be a problem in Nigeria?
No. Because the way we fight Ebola, I think with that spirit we can quash out coronavirus.
Not really. I'm not worried because we were able to overcome Ebola, so obviously we'll be able to overcome this coronavirus.
There was a time when there's talk of Ebola, so I didn't see anybody that Ebola affects. So I don't have any worry about this disease.
One of the reasons why most Nigerians are not panicking is because Nigeria is no stranger to disease outbreaks. For example, in 2014, the Ebola virus arrived here in Lagos, a city of 20 million people. It could have been an epidemic, but that virus was successfully contained. And now Nigerian health authorities are receiving praise from around the world, including the World Health Organization, for their efforts in stopping the spread of coronavirus. Passengers coming into the country have to undergo health screenings at different ports of entry. They must pass on all their information to authorities. This is an example of the form that passengers are expected to fill as soon as they arrive in Nigeria, before they even come down from the airplane. Now, it includes information like biodata information, flight information, health symptoms, and there's a question here that says, in the last 2 weeks, have you had contact with anyone who was ill or not feeling well? So after filling this form, they're expected to submit it to health officials over there on that counter. The passengers and those they have made contact with will be contacted if there is any suspected case of the virus on their flight. Even though most Nigerians I spoke to are confident that the virus will not affect them, experts warn that if the virus eventually spreads, there simply aren't enough basic facilities and devices like respiratory machines to care for all patients.